Have you ever wondered what happens if you hold your pee in for too long? It's a question that might have crossed your mind before, especially during those moments when a restroom seems miles away. When we feel the need to urinate, it's a signal from our body that our bladder is getting full. This muscular sac in the lower abdomen stores urine from the kidneys before it exits the body. Now, the bladder is quite accommodating, typically holding about 2 cups of urine, give or take. When it's about halfway full, it begins to send signals to your brain saying, "Hey, we could use a bathroom break here." You feel that familiar pressure, that urge to urinate. But what if you choose to ignore this signal, perhaps because you're in the middle of something exciting or simply can't find a restroom? So, what happens when we ignore this urge and hold in our pee? Let's explore that in our next scene. When we decide to hold in our pee, our body goes through a series of steps. Firstly, let's talk about our bladder. Think of it as a stretchy, balloon-like organ that expands as it fills with urine. Under normal circumstances, when the bladder is about half full, it starts sending signals to a specific area in the brain, the pontine micturition center, to be precise. This signal is essentially a gentle nudge, a polite way of saying, "Hey, we might need to go to the bathroom soon." Now, if we're in the middle of something important, like a meeting or an exciting movie, or maybe we're just too cozy in bed to get up, we make a conscious decision to hold in our pee. How does that work? Well, when we decide to hold it in, our brain sends a return signal back to the bladder. This signal activates the sphincter muscles at the base of the bladder, causing them to tighten up and prevent the release of urine. While this is happening, the detrusor muscle, which forms the wall of the bladder, relaxes to accommodate the additional urine. It's like a game of tug-of-war, with the sphincter muscles pulling one way to hold in the urine, and the detrusor muscle stretching the other way to make room for more. This process is a testament to our body's remarkable ability to maintain control in situations where a restroom isn't immediately available. It's a well-coordinated dance between the brain and the bladder, a delicate balance of give and take that allows us to decide when and where we urinate. This is where the magic happens, where our body's sophisticated communication system comes into play, navigating the intricate balance between necessity and convenience. But this back-and-forth communication between the bladder and brain can't go on forever. After all, even the most patient of bladders has its limits. And when those limits are reached, well, that's a story for the next scene. There are several health risks associated with holding in your pee for too long. Firstly, let's talk about urinary tract infections, or UTIs. You see, your urinary system is designed to flush out bacteria. However, when you hold in your pee, the bacteria that might be present in your urinary tract get more time to multiply, which can lead to an infection. Women are particularly at risk given the shorter length of their urethra, which allows bacteria to reach the bladder more quickly. Next on the list are bladder infections, also known as cystitis. Similar to UTIs, bladder infections occur when bacteria multiply in the bladder, leading to inflammation. Holding in pee can contribute to this condition by giving bacteria ample time to grow. Symptoms can include a persistent urge to urinate, a burning sensation during urination, and lower belly pain. Now, let's move on to kidney stones. You might wonder, how does holding in pee lead to kidney stones? Well, when urine stays in your bladder for too long, it can cause the minerals in the urine to crystallize, forming these painful stones. If the stones become too large to pass naturally, they can cause severe pain and may require medical intervention. But that's not all. Holding in pee can also lead to a weakened bladder. Over time, your bladder can become overstretched, just like a balloon filled with too much air. This can make it difficult for your bladder to fully empty when you do finally go to the restroom, leading to urinary retention. Furthermore, in severe cases, chronic retention of urine can cause the bladder to burst, which is a medical emergency. Although this is rare, it's a risk that increases when holding in pee becomes a regular habit. So as you can see, the risks of holding in your pee can be quite serious and wide-ranging. From urinary tract infections and bladder infections to kidney stones and weakened bladders, the consequences can be painful and potentially dangerous. The risks can escalate even further if this becomes a habit. So it's always best to listen to your body and go when you need to go, don't hold it in. Chronic pee holding can lead to some serious complications. Let's delve a little deeper into the long-term effects of regularly holding in your pee. One of the most notable complications is bladder damage. The bladder is a flexible, muscular organ that expands and contracts as it fills and empties. It's designed to hold a certain amount of urine, generally around 2 cups. And when you regularly exceed this capacity, it can lead to problems. By consistently holding in your pee, you're forcing your bladder to stretch beyond its normal capacity. This constant overextension can weaken the bladder muscles over time, making it harder for it to contract and fully empty. This condition is known as urinary retention, and it can lead to a constant feeling of needing to urinate, even when your bladder isn't full. But that's not all. The damage to your bladder muscles can also lead to a loss of bladder control, or incontinence. This means that you might find it harder to hold in your pee when you want to, leading to embarrassing accidents. In severe cases, this could even mean needing to wear adult diapers or pads to manage the leakage. Furthermore, urinary retention can increase the risk of urinary tract infections or UTIs. This is because bacteria have more time to multiply in the urine that's left sitting in your bladder. UTIs can be painful and uncomfortable, and if left untreated, can spread to your kidneys, causing more serious health problems. In addition, chronic pee holding can also increase the risk of kidney stones. These are hard deposits of minerals and salts that form in your kidneys. They can cause severe pain and may require medical treatment to remove. So what should you do instead? The answer is simple. Listen to your body. When you feel the urge to pee, it's your body's way of telling you that your bladder is full and it's time to empty it. Ignoring this signal on a regular basis can lead to the chronic complications we've just discussed. So, make it a point to urinate regularly and avoid holding in your pee for extended periods of time. It's important to listen to your body and urinate when you need to. Now that might seem like a no-brainer, but it's astonishing how often we overlook this basic bodily function. Regular urination is crucial for maintaining bladder health. But why is that? Let's delve into it. The bladder, an ingenious little organ, is part of our body's waste disposal system. It collects and stores urine, the waste product created by our kidneys as they filter our blood. Regular urination ensures that this waste is promptly and efficiently expelled from our bodies. But when we hold in our pee, the bladder gets overstretched. Imagine it like an overfilled water balloon. This can weaken the bladder muscles over time, making it harder for the bladder to fully empty itself during urination. This can lead to discomfort, urinary incontinence, and even more serious complications. Moreover, regular urination helps prevent the buildup of bacteria in the urinary tract. You see, urine isn't sterile. It can contain bacteria that, if given the chance to multiply, can cause urinary tract infections. These infections can be painful and can cause serious health problems if they spread to the kidneys. So how often should we be going? Well, it varies from person to person, but on average, peeing 4 to 10 times a day is considered normal. Factors like hydration levels, diet, and lifestyle can influence the frequency. It's also worth noting that certain conditions such as diabetes or urinary tract infections can cause you to urinate more frequently. So if you notice any sudden changes in your urination patterns, it's always a good idea to seek medical advice. In conclusion, urination is more than just a mundane daily routine. It's a vital bodily function that helps maintain our overall health. So next time you feel the urge to go, remember, it's not just about immediate comfort. It's about long-term well-being. Remember, it's not worth risking your health to hold in your pee. So listen to your body, respect its signals, and let nature take its course. After all, health is wealth. So let's quickly recap what we've discussed today. We've explored the urge to urinate, the body's natural call to get rid of waste. We then moved to the process of holding in pee, a common practice that many of us are guilty of. Despite its convenience in certain scenarios, we've learned that it's not without its risks. From the immediate discomfort to the potential for urinary tract infections, holding in pee can lead to a number of health complications. We've also delved into the chronic issues that can arise from this habit, including bladder stretching and kidney problems. Finally, we underscored the importance of regular urination. Like many bodily functions, it's a simple yet crucial part of maintaining our overall health. So the next time you feel the urge to go, don't ignore it. Your body will thank you.